Hi Karen, Amber Martins. I'm going to be doing my IV insertion skill. So the first thing I would do before I started the skill is I would check the physician's orders, because depending on why he's ordering what the insertion would depend on what size of needle I'm using and where I'm putting it in the patient's arm. So I would check those two things out before I even went into the patient's room. Then I would gather all of my supplies, and then when I went into the patient's room, I would make sure that they understood what was going on and knew everything. And I have my brother in here so that I can put a tourniquet on his arm, and then I'm going to have him go out. So there's a few things that I can do to enhance the dilation of a vein. That includes using warm compresses for 5 to 10 minutes before trying to find it. Having the patient clench their fist, lowering their wrist below the level of their heart, or gently tapping the vein to help it engorge properly, so that I can find it better, or using a tourniquet. So I'm going to be using a tourniquet. Things that I would need to be aware of is avoiding sides. If the patient had had a mastectomy, avoiding that side, avoiding sides that were affected by a stroke, or if they had shunts in for dialysis. So those are all things that I could take into consideration, and if the patient was right-handed or left-handed or that type of stuff. So I'd have my patient laying here, I would put my tourniquet on, so that it can easily be released with one hand. Then I would search for a vein that was bouncy, yet still firm and stable, had good blood supply, all of that, and not leave the tourniquet on for over 2 minutes at a time without giving the patient a break. So after I found my vein, then I would take the tourniquet off, and you can go. Thanks. So I found my vein, I took my tourniquet off, I have my hand here that I'm going to be putting, and like I said, I have my supplies. So first thing I would do is I open my ChloroPrep, break it away from the patient and I, and friction activates ChloroPrep, so I would be sure to use a lot of friction while washing the vein and cleansing around the area of the vein. And then while that's drying, I would open up my supplies here. I've got my needle, 2x2. And then this one I had to reuse, so I'm just pretending that I'm opening it for the first time. So I just open that. Then I would just quickly get this ready and flush it. Prime it and flush it. While maintaining sterile to sterile. And then prime. And then I would loosen the cap up so that it's ready to go. So when I came in the room, I would make sure that my patient understood the procedure and what was going on. And I would have identified my patient and all of those precautions, all the standard presets. Then, after opening my supplies, I would wash my hands. I got my tape ready, and I would put my gloves on. So, first thing I would do before inserting the needle is I would not touch this side again, because now it's clean. I would apply the tourniquet. Got my needle here. Okay. I'm holding it with my middle finger and my thumb, and I have my index finger on the notch. I would want to put it in at a 30-degree angle. I'm holding the patient's skin taut so that I'm not only holding the skin taut, but I'm making the vein stabilized and holding it in place. I put it in at a 30-degree angle, being careful to not touch my glove with the catheter tip. Once I get it in, I would look for blood return. If I didn't get blood return right away, I'd maybe come back out a little bit, go over to the right, or go over to the left, whichever. Once I got blood return, okay, I got blood return, I would let go. I would undo the tourniquet, and I would put the needle down to a 10 to 15-degree angle once I have that blood return. So then I would, at the same time while I'm pushing the catheter in, I would be pulling the needle out until I hear the click. And then once I hear the click, reach over here, grab some tape, and I will put some tape on to just help hold it in place. Not right over the insertion site, but close to. This is the part where I have my patient hold very still so that I can get these other things on and so that the IV site doesn't get lost. And then I would put the tegaderm over with a little notch over that insertion site. Okay, after I got my tegaderm on, and my 2x2 underneath to help with sterility and if there's any blood. And I would grab my saline lock and my flush. Now, before I disconnect this, I want to make sure that I apply pressure above the insertion, or like on the vein above the insertion site. And use my other finger to stabilize. So I'm just going to loosen that a little bit. So I'm just going to take it off. Now, if there was a drop of blood, it would just go right on the 2x2 there. Keeping this sterile. Attach that. Then I would aspirate, make sure that I'm in a vein. If I get blood return, then I know that I'm in a vein. And then I would just flush. While I'm flushing, I'm watching for signs of infiltration at the site, seeing if I'm meeting any resistance at all, and if the patient's complaining of any pain. There's no complications with my patient, so I disconnect that, and then take this out. I'm going to secure it so that I don't lose that. Right.
Got a minute and 30 seconds.
Then, after I put the tape on, then I have my initials and the date, which this is way too big of a piece, but I would put that across the tegaderm. I hope I said that I would undo the tourniquet. I think that I did. Then I take my gloves off, wash my hands, do all my standard post steps, make sure that my patient was comfortable and all that jazz. And then when I went out, things that I would chart is the number of attempts that I used, the size of gauge of needle that I used, if there were any complications, what side it was, like if it was the left outer forearm or right outer forearm or whatever, if there was any complications, if I hung a solution, a type of solution, what kind it was, if I was using a pump, and the rate that the pump was set at. And I think that's it. See you Friday.